Hi everyone, I'm Anjay Rastogi. I'm the director of the Core Kidney Program at UCLA Health and also the clinical chief of the Division of Nephrology. And today we'll be going over the 136th Tournament of Roses Parade and the Core Kidney Float. But before that, just a bit of a background why we are in the Tournament of Roses Parade in the first place. As probably a lot of you know, we actually participated this year in 2024 and were honored by the Isabella Coleman Award, one of the most prestigious awards that we can get at the Tournament of Roses. Now, I'm a nephrologist, and the purpose of these floats is to increase kidney health awareness. And what are the current statistics on kidney health? 1 in 3 adults in the US are at risk of having kidney disease. 1 in 7 actually have it. That puts almost 37 million people in the US have chronic kidney disease. But what's even more glaring is only 1 in 10 know that. So 9 out of 10 people who have kidney disease don't know that they have kidney problems. And by the time they're identified, it is quite late. The other staggering number, which a lot of people don't know, we have 5 stages of chronic kidney disease, stage 1 to stage 5. And stage 5 is what we call end-stage kidney disease. That's a stage in which you need dialysis or transplant to survive. But there's a higher likelihood that a patient will pass away in stage 3 rather than progress to stage 4 or 5. So these numbers are quite staggering, the morbidity, the mortality, but also the financial cost. So this year in 2024, we decided to have a core kidney float. And the purpose of that float was, number one, to increase kidney health awareness, but also to honor our living kidney donors. And one of the things that I want to say about living kidney donors, they are special people. You know, when a human being gives a part of their kidney, putting them at risk to save somebody else's life, and they just don't impact a person's life or their family, they impact society, they impact humanity. So a big shout out to all our living kidney donors for all that they have done, and we are very, very grateful. Now, let's get into our float for 2025. And the title of the float is It Takes Two. So what does It Takes Two really mean? It can mean what you think it means. It can mean that it takes a simple blood and urine test to diagnose most of the patients with kidney disease. So a simple blood and urine test. It could be a kidney donor and a kidney recipient. It could be the kidney doctor and the patient. So the message from It Takes Two is quite profound and wide. So and that's the title of our float this year. But let's look at the symbolism of the float. As from last year, the Hummingbird was really a key driver pulling the float. And we still have the Hummingbird in this year's or next year's float, actually 2025. And in Native American culture, among other things, it symbolizes spirituality. Now, at the center of the float, which is the front of the float, but I call it the center because it's really where we're focusing on, is a lotus flower. And what is a lotus flower and what does it really mean? It's a beautiful flower. We all know that. It's an aquatic flower and it's tied to the bottom of the pond where it's growing. And the water that's growing in tends to be muddy and murky. And the lotus symbolizes a patient who overcomes adversity. And the flower is beautiful. And even though it's growing in a place that's murky and muddy, it inspires other people. So that's our lotus. And the lotus flower is being held by a pair of hands. And what does a pair of hands mean? Pair of hands means take it in your hand. It's empowerment. It's taking control. It also symbolizes gratitude. And I think that we should all be grateful for something in our life. And for most people, there might be multiple things. So that's where the hands come in. And behind the hands are 2 kidneys. And these are basically trees that resemble kidneys, the tree of life. And they are patients standing or sitting underneath these trees. Then there's a bridge, and this is the bridge of life. And it could be multiple things. It could be getting on home dialysis. It could be getting a transplant. It could be connecting with teams and caregivers. And at the back, at the end of the float is a gazebo. And that is your community that supports you through this journey. There's one more thing in this float, which is quite obvious when you'll see the float. It's a boom box, which we also call the bloom box. And this boombox is going back to the 1980s, and that's where It Takes Two, the raw bass song that came out. And the whole idea of the boombox is that we want to shout out the message that kidney health is important, take control, get tested, and increase awareness. And the last thing that I do want to mention is once again our kidney donors. So once again, a big shout out to them, that thank you for all that you have done. And hopefully all of you will be able to participate in this float. So talking about the participation, how can you participate? And there are multiple ways. Number one is to get the message out on social media. Follow us on Core Kidney. Just go to social media and put Core Kidney, follow us, like us, repost, and put messages. But there's also another campaign we started, and we did last year too, and we'll be doing this year as well, is Buy a Rose. It's a very simple. You text 41444, buy a rose, one word, no dots in between. And for $10, you can buy a rose for your loved one. And the key thing over here is it doesn't have to be a kidney patient. You can buy a rose for somebody you admire, somebody who has made a difference in your life. And you start at $10 and you can buy as many roses as you want. And all this money is tax deductible and will go to a good cause. And that is to increase kidney health awareness. And we are also planning to have a digital wall that we call the tribute wall. And your name will show up on that wall that you bought a flower for this person. And you can put the flower yourself. You can come to Irvindale where the floats are being made and put, or we can put that flower on your behalf on the float. And like I said, it's the float is not the end, but it's the start. And in 2025, we once again to increase the kidney health awareness. So we want everybody to participate, get tested. The disease, kidney disease, like I said, is asymptomatic. 9 out of 10 people don't know. I also want to point out that diabetes is the biggest driver of kidney disease in the US. So especially if you have diabetes, do get tested. There are guidelines that will tell you how often you need to get tested. So with that, I want to thank everyone for listening to this. If you have any questions, our information is going to be, and I hope I see you at the Rose Parade. Thank you so much.